In the IDES process, you'll have lots of questions. And so you'll ask most of those to your Peblo and they'll be able to help you. But what we decided to do is give you some frequently asked questions that might help you navigate at least the first parts of the process and understand sort of what some of the decisions that you'll have to make. So the first question I'm often asked is, how long does IDES take? How long does it take to get through an MEB? Well, the answer truly is it varies a lot, but you can expect somewhere between 3 to 6 months for the IDES process to complete. Now, if you have lots of questions or you have lots of appeals, it can take much, much longer than that. And occasionally, if the case is very simple, it can be shorter than that. But 3 to 6 months is really a good estimate. Now let's talk about the next question. Oftentimes people ask, can I waive the IDES process if I'm near my ETS or retirement date? Well, the answer is yes. If you're very close to ETS and retirement, the Army cannot hold you on longer than your ETS or retirement date in order to complete the med board process. However, if you desire to, the Army cannot dismiss you before the process is done. So really, in this case, it's in the soldier's court as far as whether they decide to waive the IDES process or whether they continue until it's complete. I'm often asked, in the IDES process, can I take leave? And what if I have use or lose leave? Well, in the early parts of the IDES process, you'll need to remain available to the military treatment facility. So leave is not approved in the early parts of the IDES process. But once you're finished the MEB and the case goes to the physical evaluation board for rating, then actually leave is encouraged. So we'd encourage you to take your leave then and simply ask your Peblo and they'll let you know when you can take leave. Once the process is finished, if you have use or lose leave, there are some requirements that you will need in order to fulfill in order to take use or lose leave after the IDES process is complete. Signature from an 06, there are several things you'll have to do. But again, your Peblo will help you with all of that. I'm often asked, Dr. Twilley, can I have surgery during the IDES process? Well, the MedCom policy and Office of the Surgeon General policy prevents medically optional surgery during the IDES process if it impedes the process completing. So what you would need to do in this case, if you need to have some surgical procedure done, is have your surgeon contact our office and we're able to figure out the right timing for the surgery so that it doesn't interfere with your IDES process. Of course, if the surgery is emergent or urgent, obviously you'd have the surgery. But understand that surgeries must be pre-approved, procedures must be pre-approved while you're in the IDES process. Soldiers will often ask, Dr. Twilley, I've gotten in the medical board because I have one condition, but what if I have other conditions come up or other conditions that get worked up while I'm in the IDES process? How do they get added to my medical board? Well, that's a great question. The IDES process continuously looks at your medical conditions, and so if you have new medical information, make sure you get that to your Peblo. And depending on where you are in the IDES process, there might be a different way to get that information added to your medical board. So the bottom line is we want to make sure that everything is in your medical board before you leave the military that needs to be there, and your Peblo can help you with that. One of the questions I often get asked is, if I'm in the med board process, do I still have to go to the field? Do I still have to do PT? Well, the answer is yes. As long as you're in the military, you are in the military. The thing that limits you is your profile. So don't do anything your profile says you shouldn't do, and do all of the things that your profile says you should do. When it comes to going to the field or field exercises, again, through the med board process, you must remain available to the military treatment facility. So you can't do field exercises that are far, far away where you can't get back to the hospital. But if it's here on Fort Campbell or someplace very close where they can get you back, obviously you can go with your unit, but if we need you back, then you need to be able to come back. So again, where you stand on the planet, that's kind of really up to your command, but you must be available to the military treatment facility throughout the time that you're in the med board process. So I hope these frequently asked questions helped you understand some of the things that people have the most concern about or most often have concerns about through the medical board process. I understand you'll have many, many more questions than those, but I think that will help you get started, and then you always have your Peblo to answer any questions you may have. Thanks.